talking about how we have been anticipating this really big outbreak and upsurge as we got into the fall season and colder weather, and that has in fact happened. We have gotten into a place where we have more cases now than we have had. You have to go back to the early spring. In fact, yesterday we had over 7,000 cases, which is way above where we were even at the worst part of the spring. We have been tracking our hospitalization rate, and that has gone up. We have more people in the hospital now than we had at the high point in the spring, over 3,000. And a lot of things are pointing to, in Pennsylvania, the fact that we are in the middle of an upsurge, and we aren't alone. The rest of the country, in fact, there's only one state where there hasn't been an upsurge, and that is the island state of Hawaii. Every other state has had an upsurge, and much of the rest of the world has seen this same upsurge. So this is not something that's unique to Pennsylvania. But it's important to note we are in a different situation right now. Back in the spring, we actually did a lot of, made a lot of effort to mitigate the disease. And we knew not much about the disease, but we were successful in making sure that our healthcare system was not overwhelmed. And that was important. It saved lives. And we know more about the disease right now. We have more things that we can do. We have personal protective equipment. We have ventilators now, and we're in a different position in that regard than we were back in the spring. So we have a different strategy now to make sure that what we do is also effective in saving lives. But the fact is that we are in a similar situation in terms of the upsurge that we anticipated. The onset of colder weather, we actually have to start thinking much more focused, in a much more focused way on measures that will protect our hospitals, our healthcare workers, and our fellow Pennsylvanians. We need to make sure that we're doing everything we can to save lives. So again, we know more about COVID than we did in the spring, and we have more tools in place than we did in the spring. And that all allows us to do what we're doing right now in a much more targeted and focused way. We want to make sure that we protect public health, but we also continue to support our very fragile economy. The new mitigation measures will focus, therefore, on reducing large gatherings and increasing enforcement of existing measures, things that are already in place. We're also advising, and I concentrate on the word advising. This is an advisory that all Pennsylvanians, in order to stay safe, ought to stay home. It's vital that every single Pennsylvanian takes these mitigation steps seriously, because what we have to keep in mind is that when we talk about COVID, a number is not just a number. It represents a person, a family member, a friend, or a neighbor who gets sick or who dies. In a few minutes, you're going to hear from Nicole. Nicole is going to share with us the story of her family's battle with COVID. Sadly, what the numbers show right now is that more people are getting sick at a faster rate than we've seen before. And behind every patient and every diagnosis is a group of people doing everything in their power to help that patient recover and stop the spread of the virus, including nurses, doctors, administrative staff, lab technicians, janitorial staff, contact tracers, and many, many others. People who work these jobs are our family members, they're our friends, they're our neighbors. And they've been pushed to the limit by more than 8 months of fighting on the front lines against this virus. Often they expose themselves to great risk in order to test, to treat, and to support those who have been stricken by this disease. Our ability to protect the public health is only as good as our healthcare system. And that's why it's critical that we protect the capacity of that system. And we include in that the healthcare workers who make that system and keep it running. Dr. Levine pointed out last week that modeling available from the Institute of Health Metrics and Evaluation, that's at the University of Washington in Seattle, projects that Pennsylvania will run out of intensive care beds in December if we do nothing. That's what they're modeling. If our healthcare system is compromised, it's not only COVID patients who are going to suffer. If we run out of hospital beds, or if we run out of hospital staff, if they're overworked to the breaking point, care is going to suffer for every patient who needs care, including those who need emergency care for illnesses, for accidents, or chronic conditions unrelated to COVID. And we cannot let our hospitals and our healthcare systems, healthcare workers, be overwhelmed. We cannot let our healthcare system crack under the strain of COVID-19. We all need to be a little more careful. We all need to commit to wearing a mask and staying home whenever possible. That's the only way to relieve the strain on our healthcare system and on our healthcare workers. It's the only way to stop our friends and our neighbors and our relatives from becoming sick. COVID is tough, but together, we Pennsylvanians, we're tougher. And if we all unite to stop the spread of this virus, we're going to succeed. We'll be stepping up enforcement of all public health orders Dr. Levine and I have put in place, but I'm betting that we all recognize our responsibility to do what we can to protect one another. And in the end, that is what's going to defeat this disease, not the enforcement. I know that this year has been hard. It's been frustrating. And we all just want to celebrate something after all the hardship and the fatigue and the sorrow of this year. But right now, all of us need to be vigilant about taking safety precautions and following COVID mitigation measures. And that includes following CDC guidance to stay home and not travel for the holidays, if you can avoid it. I know it's painful. I know it's painful to miss seeing our loved ones, but we can keep them safe by keeping our distance this year. The point is, we are all safer at home. While there is a light on the horizon with the announcement of 2 vaccine trials that are meeting with great success, we aren't out of the woods yet. In fact, right now, as of today, we are in a very dangerous situation, and we need to work together to stop the spread of COVID-19. Each and every one of us needs to follow mitigation measures to stay safe. That's the best way to protect our families. It's the best way to protect our communities. It's the best way to protect our healthcare workers who do so much to keep us safe. You matter as Pennsylvanians, and so do your actions. When we make good choices and follow mitigation measures, we actually get good results. So let's work together, all of us, to stop this spread. Thank you, and now I'm going to turn this over to Secretary Rachel Levine. Dr. Levine.
Good afternoon. Thank you, Governor. Today, we are reporting 3,379 individuals are hospitalized due to COVID-19 as of 8 a.m. 775 of the individuals hospitalized with COVID-19 are in the intensive care unit. 371 of the individuals hospitalized with COVID-19 are on a ventilator. The trend in the 14-day moving average of the number of hospitalized patients per day has increased by more than 2,100 since the end of September. Now, today we are reporting 4,762 new cases, and then yesterday, on Sunday, we're reporting 7,075 new cases. This brings the total number of COVID-19 cases in Pennsylvania to 314,401. Of our total cases, 63% are considered recovered, meaning that it has been more than 30 days past the patient's positive test or onset of symptoms. Tragically, 28 new deaths were reported in our data today and 41 from Sunday, for now a total of 9,870 deaths attributed to COVID-19. That means in the last week we have reported actually 545 new deaths across Pennsylvania from this virus. The statewide percent positivity, as reported today on the early warning monitoring dashboard, is now up to 11% statewide. And actually, there's only one county, Cameron County, in the state with a percent positivity below 5%. Throughout the pandemic, there have been nearly 24,000 cases of COVID-19 among children, 5 to 18 years of age. 7,100 of those have been recorded in the last 2 weeks alone. Last week, we put into place some targeted mitigation efforts. Today, we are adding additional safeguards for Pennsylvania as we head into the holiday season. As the Secretary of Health, I have issued a series of advisories and orders intended to help stop the spread during this critical time to protect our hospitals, our healthcare workers, and the lives of our fellow Pennsylvanians. These measures include targeted protections for businesses and gatherings, an advisory, as the governor has discussed, for Pennsylvanians to please stay at home, a commitment by schools to protect students and staff, steps to protect our hospital capacity to treat sick patients, empowering local governments to take action to protect their own communities, and a new enforcement plan that includes liability protection for businesses enforcing the now strengthened masking order. I have issued an order to suspend alcohol sales at all bars and restaurants at 5 p.m. on just one night, Wednesday, November 25th, until 8 a.m. on Thursday, November 26th. That's a one-night suspension of alcohol sales at all bars and restaurants, starting at 5 p.m. on Wednesday. Indoor dining capacity remains at 25% unless an establishment has self-certified that they are following all of the COVID guidelines, and then it is 50%. Effective November 27th, businesses must allow employees to telework when possible. And we have reinforced cleaning standards for workplaces where employees are not teleworking. Retail establishments are required to continue to operate at 75% capacity. Gyms, salons, barbershops, and other personal care establishments can continue to operate at 50% capacity. Large gatherings and events are now reduced. There is a matrix for that, but in general, events with more than 500 people indoors are prohibited, and events with more than 2,500 people outdoors are also prohibited. I have also issued an advisory for Pennsylvanians to avoid leaving their homes unless it is absolutely necessary. Please stay at home. This stay-at-home advisory is not a shutdown order, but transmission of COVID-19 is reaching new heights that we have not yet encountered. And as the governor said, you're much safer at home. This advisory goes into effect today. We are also advising against gatherings with people who are not part of your immediate household. And the governor and I know that this is very challenging. This is very difficult, especially with Thanksgiving this week and other holidays coming later. But having someone in your home who does not live with you, not part of your household, even if they're part of your extended family or your close friends, it puts your entire household at risk. It puts your health at risk and your family health at risk. Now, for public schools, it is still our priority to have and maintain in-person instruction when possible. However, there are 59 counties that have been at the substantial transmission level for at least 2 weeks now. And our recommendation at that level has been for schools to go fully remote for instruction. Our recommendations for schools have not changed. While the decision on instructional models is still a local one, public schools in a county that is in the substantial level range for more than 2 weeks will be required to sign an attestation form to confirm that all safety protocols are in place, such as universal masking, responding to cases of COVID-19 in a school setting, if they wish to continue to provide in-person or blended instructional models. This is an attestation form. Those public schools, however, that do not sign the attestation form or do not comply with the attestation recommendations or orders will be required to provide only full remote learning and they will suspend all extracurricular activities as long as the county remains in substantial transmission or until the school attests and complies with the safety protocols. Since the start of the pandemic, we have worked very closely with healthcare coalition regions and the entire healthcare community to make sure that Pennsylvania is prepared to care for patients. The governor and I are very proud of the work that has been done with the healthcare coalitions and healthcare hospitals and healthcare regions together. While these coalitions continue to work together, we are closely monitoring the potential for staffing shortages, spikes in COVID-19 admissions, and sharp reductions in hospital bed availability in each of the healthcare coalition regions to determine when an intervention will need to be triggered. As a safeguard, when the region meets these quantifiable triggers, these specific triggers, hospitals will be required to temporarily reduce elective procedures in order to ensure adequate capacity and resources to meet the strain of the COVID-19 resurgence. This will be done on a regional basis, not statewide. Regions will be notified daily when the triggers are no longer met, and therefore full elective procedures can resume at a full schedule. Orders already in place and those announced today will be enforced, and law enforcement and state agencies will be stepping up enforcement efforts, issuing citations and fines, and possible regulatory actions for repeat offenders. It has to be our collective responsibility to protect our communities, our healthcare workers, and our most vulnerable Pennsylvanians from COVID-19. That is our collective responsibility. Nicole's family knows this firsthand, and Nicole wanted to share her family's story with you. Nicole?
Hi, good afternoon. Thank you, Governor Wolf and Dr. Levine, for this opportunity to share my father-in-law, Jack Farraguna's story. I'm speaking today on behalf of his family, including his widow, Derry, his daughter, Leslie, and his son, my husband, John. This is Jack, and he's more than a COVID statistic. He's loved and he's missed. He was coal region born and raised, rugged but sweet, wise with a splendid sense of humor. He loved to rabbit hunt with his dachshunds, fly fishing and gardening. He was a Korean War vet, and when he was 16, he tried to join the Army during World War II so he could fight alongside his older brother. For 40 plus years, he was an iron worker. And in '92, he'd been through a lot, and he fought for our country, and he worked hard all of his life. Like many who have loved ones in nursing homes, we were fearful from the beginning. These are some of the most vulnerable people who are counting on the rest of us to keep them safe. In June, our fears became reality when Jack's nursing home became infected. First, it was a few staff, then a few residents. With Jack's underlying conditions, we were very worried. We made some calls, and the Department of Aging connected us with an amazing organization called Roads to Freedom Center for Independent Living. They offered help through their disaster relief and relocation program. They offered Jack something we never thought possible, a pathway home. Jack had tested negative those first few days, and we were feeling very hopeful. Unfortunately, COVID is persistent, and the day we learned that he tested positive, our hearts sank. We honestly thought we may never see him again. But the center said he could still be sent home as long as he was properly quarantined and continued to show mild symptoms. But on the day he was supposed to come home, Jack instead was rushed to the Geisinger Danville and admitted to their COVID ICU. We were fortunate at the time that the ICU was not overwhelmed and that Jack could get exceptional care. The paramedics didn't think he would make it, honestly. But after a few days, it seemed he had beat the virus. His homecoming was bittersweet since he had to be quarantined, of course. A week after his discharge, he had to return to the COVID ICU because he couldn't breathe, and he said he felt like he was dying. It turns out he had a blood clot in his lung, something very common with COVID. Thankfully, it was caught early. He returned home once again. This time, they had recommended hospice care because his lungs kept filling up with fluid. The good news was he had been cleared of quarantine and his wife, Derry, could move home. We spent the summer taking him outside for walks around his old neighborhood, sitting on the porch and letting him hold and pet his grandpups. Dachshunds, of course. In September, he took a turn for the worse. He was in incredible pain towards those final days, and we're not sure if that was COVID related or not, and his breathing was extremely labored. His official death was not noted as COVID, but we know that it took its toll on his body and his organs. We extend our heartfelt thanks to the frontline health workers who cared for Jack along the way. We are forever grateful that we could bring Jack home, spend precious time with him, and be there when it was time to say goodbye, something we can't take for granted during a pandemic. Our loss and pain is real. We have encountered individuals who think this pandemic is a hoax or attempt to downplay its seriousness, and that is hurtful. Unfortunately, we know that their denials will lead to more people needlessly dying. If not for COVID, we believe Jack would still be with us. This photo was taken not long before the pandemic started, and he was doing really well. We have friends in the medical field who are caring for COVID patients, friends who have lost loved ones during this pandemic, and friends who have struggled with the virus themselves. We are taking every precaution we can so other families do not have to experience this loss. I wish more people would have heeded the warnings because maybe Jack would still be here. The empty chair at the kitchen table is no more profound than at this time during the holidays. And wearing a mask and social distancing is such a small sacrifice to keep our loved ones safe.
Nicole, thank you so much for sharing your story with us and your family's story. Certainly our thoughts are with you and our condolences. Thank you. The governor and I are pleased to answer questions.
Thank you, Secretary. Before we get to questions, just a couple of notes for reporters. You'll be called on in the order that you RSVP'd for the press conference. If you mute yourself after asking your first question, we'll assume you don't have a follow-up and move on to the next reporter. First up, we have Jan Murphy from Penn Live. Jan, just give me 1 second to go ahead and unmute you. Jan, go ahead and unmute yourself. Jan, there is a terrible echo.
Yeah, I know.
Can you circle back to me, see if I can address this? Yep, I'll circle back around. Okay, and just one note for everyone, please make sure that we stay on, we're covering questions on this topic. Any additional questions that you may have, we will follow up afterwards with the governor's office. Let's go ahead to... Jan, are you still with us? Okay, next up is Hayden from PBS 39. Go ahead, Hayden. Okay, Hayden says to go, feel free to pass. Next up is Jamie Martinez. Jamie, go ahead and unmute yourself.
Can you hear me?
Yes.
Okay. Thank you again, Dr. Levine. Can you give us some more details on the data points that would trip the hospital cutbacks on elective procedures? And are any of the regions currently exceeding those data points right now?
So there are three. So none of the regions would trigger the 50% decrease in elective admissions at this time. The triggers include staffing shortages, that 33% or more of the hospitals in the region anticipate staffing shortages within the next week. The second metric is COVID-19 surge. Our greater than 50% increase in the moving average of COVID-19 admissions in the region in the last 48 hours. And the third is in terms of bed availability, that less than 10% of the total staffed medical surgical beds in a region are anticipated to be available for patient care in the next 72 hours. So a region would have to be very challenged from a bed availability point of view, having more and more COVID admissions and staffing shortages to trigger a 50% reduction in elective admissions for 1 week, regionally. At the same time, as I called for last week, we want to partner with and collaborate with the hospitals and health systems, as well as the healthcare coalitions, to work to make sure that we have adequate hospital capacity for COVID-19 patients and non-COVID-19 patients, as the governor has mentioned.
And Dr. Levine, if I may follow up on that, in the release from earlier today that outlines some of our statewide data points, there was a quote from you in there that referenced the University of Washington projections, noting that we could run out of ICU beds within a week. So, I mean, how close are we in some regions or in any of the regions, if you could be specific, to reaching those dire checkpoints that you just outlined?
So we're not there. Probably most of the regions are doing very well. The Northeast region is probably the most challenged in terms of just bed availability, but we're not anticipating any staffing shortages, and they have not had the COVID-19 surge. So we're not there. But you're right. I mean, we've been watching the IHME University of Washington model, and it's very concerning. I mean, right now we have up to 7,000 new patients a day. They are projecting that unless things change, which is why we're doing these mitigation efforts, that we could have up to 20,000 or more new patients every day. We're seeing up to 100 or more deaths a day. They project we could see 150 deaths a day. And so very, very concerning modeling. As you pointed out, the concerns about ICU capacity. So we're going to watch that very closely throughout all of our regions every day, and we'll see if this is triggered.
Next up is Ron Southwick. Go ahead, Ron.
Hi, good afternoon. I just wanted to get a sense of some of the guidance you were talking about with schools in terms of the attestation form they're going to have to certify with the state if they want to continue in-person instruction. Could you outline the steps schools are going to have to take? And is there a point where the state will be making the decision to shift to remote instructions for schools in those counties, or if they're not satisfied with those steps?
Well, so there is an attestation form that basically they're going to be following the rules, that they're going to have universal masking and attempt as much as possible to do social distancing, that they'll be following all of the guidelines. If they attest to that, then they can maintain local control in terms of their decisions. If they do not attest to that, or if they attest to it and they're in violation of that, then the state would step in and the school would go remote. Governor, is there anything else you'd like to add? Okay.
Ron, any follow-up?
Yes. How will you determine if the schools are following up or doing what you want?
Well, the collaboration, as always, between the Pennsylvania Department of Health and the Pennsylvania Department of Education, and of course the governor's office, and we have very good knowledge of what are going on in the school districts, and so we'll be observing.
Next up is Paul Go from the Pittsburgh Business Times. Go ahead, Paul.
Hi, thank you for taking my questions. The first one is, what will resources be brought to bear from the state level when ICU beds are filled, and how will ICU capacity be increased? And I have a follow-up too.
Well, the goal is that the ICUs are not overwhelmed and that they're not filled, particularly within a whole region. And so that will involve the collaboration with the Department of Health, the healthcare coalitions, and the hospitals and health systems themselves, is that if one hospital is being challenged and they are filling up, that other hospitals in the region make sure that they have capacity and that there are adequate transfers. So if one hospital we're having difficulty with in terms of surge, that other hospitals then are able to take that load. And so it really needs to be done on a regional basis, and we need that collaboration. And we have assurances from the hospitals and the hospital association that they will be collaborating in terms of staffing, in terms of bed availability, in terms of PPE, et cetera. And that collaboration is going to be key.
Thank you. And the second question is, hospitalizations, I guess, lag by about 2 weeks or so. Are you prepared to take further steps? And what might they be, given that what we're seeing for rises now are hospitalizations 2 weeks from now?
Well, you're correct. Hospitalizations lag increases in new cases by about 2 weeks or more. And so that's why we're projecting, and that's why we're talking about the steps we're taking today, as well as the collaboration that we talked about last week. In the future, as time goes by, if we see that other steps need to be taken, then we'll take them. But these are the steps we're taking now. Yes, Governor, of course.
So that's exactly why we're looking at the hospitalization is a bit of a lagging indicator, but the availability of staff is not. And the availability of ICU beds, that's a daily indicator. So we're looking at things, and we have been throughout this whole process, at things that are contemporaneous. And so understanding how much of a lag or lead there might be in certain things, that has led us to what we think are appropriate cushions in this model. So by the time we see hospitals triggering 2/3 of these things, we should be in a situation where they can do something about it on a timely basis, again, reducing their elective procedures.
Next up is John Misick from Penn Capital Star. John, go ahead.
Thanks, April. Dr. Levine, can you explain the reasoning for the 5 p.m. shutdown time for restaurants? The Wednesday before Thanksgiving is traditionally one of the biggest evenings of the year. And then a follow-up for Governor Wolf on the same matter.
He's going to take up.
Yeah, John, I'll take the follow-up too. But it turns out that the biggest day for drinking is the Wednesday before Thanksgiving. I don't like that any more that are doing or addressing that any more than anybody else does, but it's a fact. And when people get together in that situation, it leads to an increase in the exchange of the fluids that leads to increased infection. And so this is one of the many steps that we're taking to say, if we all do this together, we're going to defeat this virus. That's what we should be focused on. Not whether we want to get a transitory benefit from going out with friends on next day after tomorrow and have some drinks. Let's forego that this one time. And if we do that and all these other things, then we're going to get back to life as we really want to live. We can go to bars anytime we want. But let's just do the things we're talking about here. And if we do this, and if we're successful, then we're going to make it through this really rough patch to the point where we have the vaccines, where the things that are really going to take us through this pandemic are going to be available to us. But we have to make it through this tough patch. Well, now what's your follow-up?
Governor, I'll stipulate to all of that. Obviously, the industry has taken it on the chin throughout the course of the pandemic, and we've all seen the shutdown numbers on any of these businesses. I wonder what you would say to bars and tavern owners, or restaurant owners for that matter, who are fearing, again, on a very busy evening, their bottom line's evaporating on them.
Again, we're not doing anything except for this day after tomorrow order. to change what has been the way restaurants have been operating. It has been tough. I mean, let's get back to which is the reason, by the way, starting in July and August, I advocated putting money into a system that would actually give financial relief to these businesses, because there's no question they have been hit hard. And we ought to do something about it. But the thing that we can't do is ignore reality and say, yeah, you folks, for no fault of your own, have been hit hardest through by this virus. But the virus is what's doing this. It's not me. It's not the administration. It's not the government. This is happening all over the country, all over the world, and it's having the same impact. And after the more we learn about it, the more we know that this is the kind of thing and the kind of place that actually speeds up the transmission of this disease. So what we're trying to do here in Pennsylvania is say, let's acknowledge reality. We hate it. It's frustrating. It is fatiguing. All the things that this pandemic has forced us to do. And all the painful things we have had to do, including not going out to a bar on Wednesday. We've got to recognize that as tough as that is, it's even tougher if people die. Back to what Nicole said about her father-in-law. We cannot have that happen. We can't look back on this and say, hey, maybe we could have done something to save some lives here. We have some bad choices, no question about it. But we've got to make those choices. We can't ignore them, and that's what we're trying to do here.
Next up is Flora Pastorera. Flora, go ahead and unmute yourself.
Thank you. Governor, can you hear me? Hello?
We can.
Governor, last week, the Secretary of Health said that we were not going to be going back to a red, yellow, green situation. That was last week. A lot has changed. Have you rethought that at this point? And if we aren't at this point going back to red, yellow, green, is there a tipping point? Does something have to occur that you would shut down the state and we would go back to stay-at-home orders?
I haven't thought of anything that would actually do that. I think we're doing everything we possibly can to make sure we never go back to that. We had to do things back in March and April. And if you think back to that time, we were just trying to buy time. We didn't have personal protective equipment. We didn't have the understanding of the disease. We didn't have the therapeutics that we have right now. We have a lot of things that we still need to do to defeat this virus, but we have a lot more in terms of resources than we did back then. And I think that's the reality. So we have been trying to do everything we can to make sure that we never have to go back to that red, yellow, green, draconian set of steps that we took back then. And that's why these targeted mitigation efforts are what we're proposing right now.
But if these mitigation efforts don't work and cases continue to go up, will there be a point when we have to go back to that situation?
Well, as I say, I can't foresee every possible eventuality, but I can't think that would make any sense. We're trying to balance the needs of a very fragile, as I said, fragile economy with the needs for all of us to keep safe. And we know more. We have much more in the way of resources right now, more in the way of knowledge. And there is light at the end of the tunnel with the vaccines. So I want to do everything I can to keep from trashing our economy the way we did back in March and April. At the same time, keep people safe. So I can't foresee, I can't conceive, and we don't have any tentative steps to go back to that old March, April system.
Next up is Hannah Brandt from ABC 27. Go ahead, Hannah.
Hi, yeah, this question could be for either of you. You've talked about stepping up law enforcement efforts. What does that look like? What does that mean? And is this not something they've already been doing? Is this new, or is this just ramping up of existing efforts?
It's a good question. In most cases, we've already been doing this, and state law enforcement and even local law enforcement have been working to enforce the directives that are in place. What we're doing here is adding a step that has been tried in other states, including Ohio. And it's basically a progressive discipline, and it's an attempt to do a better job of protecting customers and employees in retail establishments. Too often, we'll have somebody who doesn't wear a mask, and so that basically throws out the safety procedures for everybody. And we're now saying we're going to actually enforce this put the enforcement on the backs of the store owner, or the store manager, and say you're going to have to make sure that the people who come into your store abide by the masking regulation. If they have a problem with that, you can serve them outside. I think the state stores are already doing that. But if they come inside, they need to follow the procedures. I mean, we have those signs that say no shirt, no shoes, no service. Well, same thing with no mask, no service. And as they do in Ohio, the first time you violate that, you get a warning. Second time, you have to close for 24 hours. Third time, you have to close for 24 hours and you get a fine. Those are the kinds of things that we find have worked in other states, and I think they can work here. Again, we have been enforcing these regulations. We have allowed, if employees or customers feel unsafe in a store, we have a hotline through the, I think, Department of Health, that they share with other agencies at the state. So that labor and industry, the state police, whomever can intervene to help protect and try to keep workers and customers safe. This just really adds to that, but it doesn't change the order that says we need to wear masks. We're just trying to do a better job of enforcing that.
Thanks. And I did have one more question on sort of a different train of thought here. For businesses that are following these health rules, there was recently a bill passed offering them liability protection. Are you planning to sign that? And what are your thoughts on that and how it might help with businesses following the rules?
Yes, there is in this, I should actually direct you to the Office of General Counsel for a full legal, because I'm not a lawyer. But it's a great point that companies that are enforcing this in their stores, if there's an altercation or something that happens that might put them at some jeopardy, there is a limited risk immunization, I guess we call immunity, that would accrue to the owner or the manager of that establishment. So yeah, I'm not as clear on exactly what was in the bill and how this compares to that, but it's the same idea.
Next up is John Finnerty. John?
Yeah, thank you. I guess could you articulate sort of what your position is regarding scholastic sports? And I know you mentioned that in a lot of places that extracurriculars will be banned if the schools go remote. But I guess, just from the standpoint of things like basketball and wrestling and kids wearing masks and playing sports and things that, if it's that bad right now, do you feel like that should just be cut off, or do you, where is your position on that?
Position right now is with this attestation that we're asking superintendents and school boards to sign. As long as they do that and follow the rules of masking. And when it comes to sports, I mean, each sport is different. You can't swim with masks. I get that. And we've actually exempted football from wearing masks. And I think there are others too. We want to have a common sense approach here. But if you're just going to violate the rules or ignore them, then extracurricular activities are going to be off the table. So just sign the attestation. It has to be in by November 30th. And each school district will continue to be in charge of its own extracurriculars and run them the way they should. Again, I think this is common sense. We understand there's certain sports where you just can't wear a mask, but to the extent you can, you ought to wear one. It makes things safer. Major League Baseball players, they wear masks. Basketball players wear masks. Those are the kinds of things that we ought to be doing to keep our sports teams safe, but also continuing to compete.
Thank you, Governor. John, do you have a follow-up?
No, that's fine.
Okay, that is all the time we have available today for questions. If you need to follow up or your question wasn't asked, please make sure to follow up with the Governor's Press Office and the Health Press Office. We'll be happy to help you. This recording will be available on pacast.com for viewing later and is being broadcast live through Facebook. Thank you so much for joining us. That concludes our briefing.
PCN is on course to bring you the PIAA Cross Country Championships. Watch the top runners from around the state compete to see who will take home PIAA gold.